Teeth is a living tissue. It has circulation, it has nerves, but when the tooth dies, it's still there, but it's not functional anymore. It's actually dead. That's why the color changes. But we don't know it. If we had any organ in the body that died out, or any tissue that died out from necrosis, we remove them. But with dental health, we actually don't do it. But as I mentioned, there's a way to revitalize the teeth sometimes. But if they're completely dead and you can't revitalize them successfully, it's better to take them out.
And then when you do remove a tooth, can you sterilize that space, the void there? Is it easy to sterilize, and so you don't get infection that way?
Yes, if you do it right. And that's the concept of cavitation, of scraping the bone. See, many dentists don't do it. They just take the tooth out, and there is still a layer of film that covers the bone, and under it you can have infections. You need to scrape the bone, and then you can use homeopathic remedies, and you can use ozone. So some dentists now inject ozone into the area after they finish. So it's completely sterilized. Yeah, it makes a whole difference. I mean, there are patients who can have physical issues, and when they have the right extraction, they feel much better immediately. And if the extraction is not done right, they feel worse immediately. I mean, I've had patients with health issues, even cancer patients. One patient with advanced cancer who had 2 huge abscesses in the front teeth that relate to it. He had prostate cancer, Gleason 10, the most aggressive prostate cancer, kills you in weeks. And his prostate cancer teeth indeed were actually infected. And here is a person with metastasis in every bone in the body. I mean, his bone scan was like, and PET scan was just lighted up completely. Getting his teeth pulled out. As they are being pulled out, his pain goes down, his sinuses feel better, and he responds to hormonal therapy for a much longer period of time than anybody would expect. So it's not that everything is in the teeth. As you know, we've done quite a few interviews, and I mean, I don't subscribe to one kind of medicine. It's part of my broad training. But dental health is very important. I mean, I have an example of another patient who I took to a very brilliant Chinese doctor many years ago. This patient had swollen lymph nodes and night sweats. Very much looked like lymphoma. And the person gave a brilliant diagnosis in Chinese medicine, and I followed the acupuncture, and it helped this person, helped their energy. And in this sense, this person was brilliant. He was the Chinese doctor I respect probably more than anyone else. But this patient had huge abscesses because of root canals from childhood that were causing the lymph nodes to swell. And the moment they were taken out, the lymph node swelling was gone and the night sweats were gone. So while we had a brilliant diagnosis in Chinese medicine, if these infected teeth with huge abscesses were not taken out, this person would have gotten lymphoma and would have died. So you need to do both worlds. You need to be open, and this is really what integration is about. It requires knowledge from the doctor, and it requires the patients to take the time to really do a very thorough evaluation. Often our patients, we give them blood tests before they see us for the first time. I mean, of course, in order to save them time, many of them fly from out of town, but just as part of a thorough approach. Even before we see them, we want to know their basis, so the first visit is more useful. So a little bit of a diversion from dental health, but you can see how dental health is tied to so many things.